How to diagnose diabetes.
According to the Center for Disease, 29 million people in the United States have been diagnosed with diabetes. Diabetes is a condition that occurs when the body stops naturally producing a hormone called insulin. Insulin converts the sugar, or glucose, we eat into energy. The glucose provides the cells in the muscles, tissues, and brain with the necessary energy to function. All types of diabetes prevent the body from processing glucose in an effective way, either due to the lack of insulin or resistance to insulin. Diagnosing type 1 diabetes, distinguish type 1, once known as juvenile or insulin-dependent diabetes, is a chronic condition most often diagnosed in children. However, it can be diagnosed during any point in a patient's life. When a patient has type 1, the pancreas makes little to no insulin. Recognize the symptoms. 1 include frequent urination, excessive thirst, extreme hunger, unusual and rapid weight loss, irritability, increased fatigue, and blurry vision. The symptoms are severe and typically come on within a few weeks or months. These symptoms can also be mistaken for the flu at first. Take the glycated hemoglobin test. This test is used to determine type 1 diabetes and prediabetes. A blood sample is taken and sent to a lab. The lab measures the amount of blood sugar attached to the hemoglobin in the blood. This reflects the patient's blood sugar levels over the past 2 or 3 months. This test results vary by the age of the person being tested. Children can have a higher percentage than adults. Get the fasting plasma glucose test. This test is the most commonly used test because it is accurate and costs less than other tests. During the test, the patient goes without food or liquid other than water for at least 8 hours. The doctors or nurses draw blood and send it to get tested for glucose levels. Do the casual, random test. This test is the least precise of the tests but is effective. The blood is drawn from the patient at any point, regardless of how much or recent the patient has eaten. If the levels come back above 200 mg/dl, then the patient may have diabetes. This could also detect type 2 diabetes. Diagnosing type 2 diabetes. Understand type 2, once called adult onset or non-insulin dependent diabetes, occurs most often in adults over 40. Type 2 diabetes develops when the body resists the effects of insulin or when the body stops producing enough insulin to maintain the glucose levels in the blood. With type 2 diabetes, the liver, fat, and muscle cells stop using insulin in the proper way. Identify the symptoms. Do not show up as early as type 1. It often isn't diagnosed until they do. The symptoms of type 2 include those associated with type 1. These symptoms are excessive thirst, frequent urination, increased fatigue, extreme hunger, unusual and rapid weight loss, and blurry vision. Take the oral glucose test. This test is given over a 2-hour period at the doctor's office. The patient's blood is drawn before the test. Next, the patient drinks a special sweet drink and waits 2 hours. Blood is then drawn over the course of the 2 hours and the levels are calculated. Take the glycated hemoglobin test. This test is also used to determine type 2 diabetes and prediabetes. Blood is taken from a patient and sent away for testing. The lab measures the blood sugar percentage attached to the patient's hemoglobin in the blood. This illustrates the patient's blood sugar levels over the past few months. Diagnosing gestational diabetes. Understand gestational diabetes is only diagnosed in pregnant women. During pregnancy, a woman's body increases the production of certain hormones and nutrients that can cause resistance to insulin. Notice the symptoms. Does not have any obvious signs or symptoms, but the mother is at risk if she lived with diabetes before the pregnancy. If you feel like you may be at risk, you can get screened before you get pregnant to see if you might have any early indicators such as prediabetes. The only way to know for sure, however, is to be screened during your pregnancy. Screen during your pregnancy. Get the initial glucose test requires the patient to drink a syrupy glucose solution. Then the patient has to wait for an hour. Once the hour is up, the blood is tested for blood sugar levels. If the levels are below 130 to 140 mg/dl, then the patient's levels are normal. If it is higher than this, you are at risk for gestational diabetes but don't necessarily have it. Take the glucose tolerance requires you to fast overnight. First thing the next morning, blood sugar levels are tested through a blood test. Then the patient drinks another syrupy glucose solution. This drink has a higher level of glucose. The blood sugar levels are checked once an hour for 3 hours. If your last two readings are higher than 130 to 140 mg/dl, then the patient is diagnosed with gestational diabetes.